Thank you very much, George, and thanks for inviting me to say a few words today. I thought I'd take it right back to the beginning in vaccines, going back 226 years. So that takes us to the 1700s, so quite a long time before the department started. And if you can cast your minds back to that time, Richard, then I can just tell you a little bit about how the world looked, because we actually know quite a lot now by looking back at some of the textbooks from the time. This is, at least according to the Swedes, the first textbook of pediatrics from Rosen von Rosenstein, translated just a few years later by Anders Storman to English, so that we had an English version of it. And interestingly, he translated it whilst on James Cook's trip around the Southern Cape, and then sent it back and had some difficulty getting it published. But at this time, when this book was published, every other child died. 1 in 2 children died in the mid-1700s. And it was on that backdrop that this is just some of the data that's been collated looking at child mortality over the last 2 millennia. And you can see that really child mortality, which the average, I don't know whether you can see I can't really show you the pointer, but the top line there is the average child mortality for the under 5s over that period of time, showing about 1 in 2 children were dying up until the 1700s. Really, it was not until the 1800s that started to change. And if we then think about what happened shortly after that treatise on child development was published, was the work of Edward Jenner, who in 1796 demonstrated the first evidence of a vaccine working, and published it in his treatise on the cause and effects of the variole vaccine, a vaccine derived from the cowpox virus. And I think brilliantly when you read that, Jenner predicted that smallpox would be eradicated. It did take a little while because it was 1977 when it was finally eradicated, but back then in 1796 he predicted that it would be. And I think we should all feel proud that Oxford University decided to award Jenner an honorary degree in 1813, an MD. Perhaps slightly less proud that it was for his work on the cuckoo rather than his work on vaccines. So we don't have such a long association with vaccines as you might have thought. But since then, there has been an enormous activity in vaccine development over the course of those 226 years, with particularly over the last century, an enormous development of different types of vaccines that have really made a big difference to human health. But the problem, even with the first 150 years of development, was that they were not very widely used. And that really changed with the polio epidemics in the 1950s and the formation of a structured process from government of vaccinating children across the population, with the establishment initially of the Joint Polio Committee and then JCVI in 1963, which has been coordinating the vaccine program ever since. And the effects of vaccination, as you can see here on this slide, have dramatically reduced many diseases which were causing a large part of that mortality in early childhood. And this decrease in all of the diseases shown here gives some examples of that. Coming to the time when the Oxford Vaccine Group was founded by Richard Moxon, you can see here, this is what the immunisation programme looked like here in the UK. These are the vaccines in the early 90s that were given to children. And I've just put one of the papers from Richard there in the bottom left-hand corner, which was some of the trials that were run in Oxfordshire of the Haemophilus influenzae type B vaccine, published in 1989, that then led to his decision that we should form a vaccine group in Oxford. Typically, it took another 5 years to persuade the powers that be in Oxford that we could call it the Oxford Vaccine Group, and that's why it wasn't founded until 1994. I arrived in 2001, and Richard handed over the reins to me. And it's been a great time for vaccines here in Oxford. This is the Oxford Vaccine Group a few years later in 2006. We had grown by 2010, and by 2019, were struggling to fit into the photograph. And in fact, now there's about 150 people in the team, and we don't have a current photo. We haven't all got together since 2019 in a group photo. 30 years since that first immunisation schedule I showed you, things have changed dramatically in what is actually being delivered in our vaccine programme to defend child and adult health through vaccination. And I wanted to talk a bit about the many programmes that over the 30 years since Richard started OVG that have been developed, but there's not enough time in the 10 minutes that George gave me. So I've just coloured in all of the different programmes that in that immunisation schedule that at the Oxford Vaccine Group have been worked on. So this is the majority of vaccines that are used here in the UK, either some of the underpinning science or often the critical trials and research that's led to the policy on their use. And we have, over that period, a very large number of programmes, many of which are ongoing today. We've made a number of vaccines of our own, which you can see on this slide, some of which are in trials at this very moment, and have been involved in the whole panoply of vaccine development from the design in the laboratory through the translational phase and then clinical development to policy and public engagement. And we've only been able to achieve that because of the most amazing global network of investigators who work with us. And you can see the locations where we have staff at this very moment working on testing, development of vaccines, on undertaking surveillance for diseases where vaccines could make a difference to human populations. And when I said there was 150 people in Oxford, in each of those sites there are teams of people around the world who are working on these. Perhaps just to mention our 17-year association with Nepal, where we've done the work that has supported the government in introduction of Hib vaccine and pneumococcal vaccines, and probably in the next year some changes to the pneumococcal vaccine programme there as a result of the surveillance we've been doing. And the huge work with Sue-Ann Clemens, who's here in the audience, in Latin America, working on COVID vaccines and hopefully much more to come in the future. I wanted to very briefly touch on two examples. The first being typhoid, we started working on here in Oxford just over 10 years ago. Because of the huge burden that we were seeing in the places we were working in around the world, and this in South Asia particularly. And we realized there was a problem in accelerating development of these vaccines because the prototypes which were being developed, no one trusted. They were mostly being made in low-income countries. And we looked at these and found one Indian company that had made a prototype vaccine which looked as if it could transform typhoid. Typhoid is a disease spread by drinking contaminated water, eating contaminated food. And so in order to do that, we set up a human challenge model here in Oxford where we deliberately infect people with typhoid in order to then test vaccines. And here you can see one of our volunteers drinking typhoid as if he got some contaminated water in order to assess whether a vaccine that he'd been given worked. And you can see he has lots of blood samples taken, and we wait to see if they develop typhoid. And this study showed that the vaccine had good efficacy against typhoid. And the data from this were then used by the World Health Organization to approve the use of the vaccine. And we went on to look at implementation in the field, and these are the beginnings of a huge trial undertaken in South Asia and Africa, where 100,000 children were randomized to either receive the typhoid vaccine or a control to see how well the vaccine would prevent infection in this population. And these studies finished just in 2019, showing that we were able to establish an 80% reduction in the burden of the disease in children in these settings in Africa and Asia. And since then, last year, 10 million children were vaccinated in a 2-week period in Pakistan, and 7.5 million children this year in Nepal to control this disease in the population which had been so rampant. And that was timely because these results all just came just before the pandemic started. This was at the end of 2019. And so we had a team of people who were very experienced in running large-scale global clinical trials. And as John and Louise said, when we got together in Oxford to think about the response to the COVID pandemic, it was very obvious that one of the things we already had as a strength was a team that could drive the clinical development. And the story of that development, I think, is well known. The first work on development of the vaccine began on the 11th of January 2020, and Theresa Lam, who's here in the audience, was involved in designing the prototype COVID vaccine, which then went into manufacturing, so that by April of 2020 we were able to stand up the clinical trials here in Oxford, giving 1,000 people 1 or 2 doses of the Oxford AstraZeneca COVID-19 vaccine. The trials continued for the next 7 months here in South Africa and in Brazil. And we had enough data by the end of 2020 to submit for regulatory approval. And that was obtained at the end of December. And that very rapidly rolled into approval in 187 countries. And the work on those approvals goes on today. We were just on a call looking at the further data sets that need to be put together to go forwards for the next stages that are required by the European Medicines Agency as part of the commitment. So the work that's required from this hasn't stopped as things have settled down. And Louise, in her introduction, commented on the huge impact of vaccines that there has been since they were first used at the end of 2020, early 21. And the analysis from Imperial suggests that in 2021 alone, about 19 million deaths were averted by the global vaccine programs. And there's a sub-analysis of that by an analyst company called Airfinity, which was referenced by the Vice-Chancellor, which indicates that around about a third of the lives saved during 2021 were as a result of the efforts from Oxford. Well, unfortunately, outbreaks remain in the news. It's not as if suddenly everything's gone away, the pandemic's sorted, and we've had all those vaccines. This is just some of the news from the last year showing that we still have this huge pressure of threat from infectious diseases, and also on our doorstep with monkeypox and the latest polio outbreak. But the good news is, and this is my looking forward slide, we have an amazing team of senior investigators on this slide who are working on a very wide variety of different disease areas in order to try and protect human populations from these diseases. I unfortunately don't have time to go through all of the programs that are being worked on, but they're using epidemiological methods, experimental medicine, including human challenge models, development of new vaccines, and also testing the existing vaccines to look at how they can be deployed differently and more effectively. And it's, I think, a very healthy time for the Oxford Vaccine Group, building on the efforts of Richard 30 years ago. Our mission really hasn't changed over that time, which is to improve health through immunisation and developing the science around that. And of course, my focus as a paediatrician has been on how to impact on that in early childhood. And you can see here that this, of course, this isn't all vaccines, this is other aspects of public health as well. But over the last 70 years, we have seen a continuing decrease in the under 5 mortality shown here on this graph. On the bottom right-hand corner there, I've shown child mortality here in the UK, which is now at 4 per 1,000 of those under 5. And remember, I started this talk by saying it was 500 per 1,000 in the 1700s before vaccines started, so a dramatic impact. The sad thing, though, of course, is that if you draw that blue line forwards to get to where we are today, it's going to take another 20 years for the rest of the world to catch up with where high-income countries have arrived. And so that means there is a lot of work for the Oxford Vaccine Group to continue to do, since a high proportion of those deaths remain deaths from infectious diseases. Thank you.